Non-communicable diseases, NCDs, like diabetes and hypertension are silently affecting millions of lives across Uganda. In peri-urban communities such as Kiswahili, Kisenyi, Biafra, Kijungu, and Chiyanja. In Mbarara City, the burden of these diseases is growing every day. Lack of awareness, limited access to health services, and unhealthy lifestyles are key contributors to this alarming rise in NCDs. But together, we can change this story. On December 14, 2024, Mbarara City witnessed a call to action as the march led by a vibrant band moved through the town, raising awareness of diabetes and hypertension. This was more than just a walk. It was a march for life, health, and hope. The campaign brought together health professionals, local leaders, and community members to spread the message that prevention and early management of NCDs can save lives. Spearheaded by the ZOHEC project under Dr. Mojisha Richard, the principal investigator, and funded by Kofi Korea Foundation for International Healthcare, the march began at the Mbarara University of Science and Technology pitch and ended at the University Inn.
We are raising awareness on hypertension, which is high blood pressure, and diabetes, which is high blood sugar. And there are many risk factors. One of them is age. Now, we may be getting older, and that we can't control. But what we can control is our salt intake and sugar intake. Let's minimize those and minimize the risk of high blood pressure and high blood sugars.
I'm here to tell you that too much drinking alcohol and too much smoking poses a risk to having hypertension and diabetes. Let us say no to such bad habits and embrace a healthier life.
Collaboration and research improve our health system. Let's support collaboration to improve our healthcare system in our villages.
Together we can reduce hypertension and diabetes. Together for healthier communities.
I would advise that as young people, we should keep our lives active, engage in sports, we should do a lot of walking, also ride our bicycles. Our hearts will thank us later.
So my message for you today on the NCDs is, did you know cutting down on salt and sugar can save your life? And small changes in your diet can make a big difference with you, and especially also with our children. Thank you.
We had to create awareness on NCDs, especially diabetes and hypertension. Seek early diagnosis of those two illnesses. Go to the health facility near you. It's free. Check for your blood glucose levels. Check your blood pressure levels. Just ensure that you're safe.
My message is that diabetes and hypertension are silent killers, but we can defeat them by eating healthy, staying active, and checking on our health regularly.
The event concluded with a panel discussion and speeches from sponsors, organizers, and implementers, highlighting ways to fight NCDs and urging the community to take action for a healthier future.
These zoonotic diseases are diseases which pass from animals to humans. Now, there were gaps in detection. You find they are detecting people when already they are bleeding. Some of them are hemorrhagic fevers. They bleed before the patients die. So that's when they realize, someone is bleeding. The antimalarials didn't work even if the blood slide was negative. These days, the clinician, even when they don't find the blood slide is negative, they don't believe it. So we are now developing a zoonotic diseases prevention training manual for healthcare workers.
For hypertension, you may not see anything whatsoever. However, you may get some small headache here and there, but if it is not confirmed early enough, it might just present when you have already collapsed, you have already got a stroke.
When we're talking about risk factors, we shall start with diabetes. Remember, diabetes is categorized into two categories. We have type 1. Of course, there are many other types of diabetes, but the ones where we mainly focus on, we have type 1 diabetes and type 2 diabetes.
One person said, if you don't make food your medicine, then medicine will become your food, and we don't wish all to be there. So let's make food our medicine.
Now, the One Health approach, to me, I believe One Health contributes to health for all. And the time is now for us to build our country's health care, because actually the health care of the country begins with us.
I take this to be a major launch, a signature moment, the beginning of a health revolution in Uganda. It's my considered opinion that as the fruits continue to gather to fall, that we'll invite other people, including our dear Vice Chancellor, Professor Pauline Jachika, to celebrate the success we are witnessing today. For God and my country, succeed we must.